Hello, welcome to KB Lim Skin Clinic. I'm Dr. Liz. This is a short video on laser hair reduction. Laser hair reduction is the preferred term for what used to be called laser hair removal. Lasers for hair reduction have been around since the 1990s, and they have essentially revolutionized the removal of unwanted hair. Laser hair reduction is one of the most commonly sought after cosmetic procedures. The procedure is satisfying to perform because the results are predictable and generally good. Methods of hair removal can be divided into home treatments and office treatments. Home treatments include tweezing, waxing, shaving, and application of depilatory chemicals. These treatments only affect the hair shaft and have no effect on the follicular growth area. Hence, treatment has to be repeated every 6 weeks or so when a new hair grows. Office treatments include electrolysis and the use of lasers and intense pulse light or IPL machines. Electrolysis involves inserting a needle electrode into every single follicle. An electric current is passed, and when it meets resistance, heat is generated, damaging the hair follicle. It is an extremely tedious procedure if you can imagine the large number of hair follicles or skin pores on the skin, and inserting an electrode accurately into the hair follicle is a huge challenge. Many treatments are necessary. In addition, electrolysis is invasive because it involves inserting a needle into the skin. Treatment is also painful and may cause complications such as infection, scarring, post-inflammatory hyperpigmentation, or dark spots on the treated areas. Lasers and IPL machines, on the other hand, are non-invasive. They do not involve inserting needles into the skin, and they can treat multiple hair follicles at a time, making treatment very fast, and in addition, there is very little discomfort. Patients often complain of a slight or mild pain, which can be easily eradicated by prior application of an anesthetic cream. Lasers can generally be used for all skin types, but intense pulse light lasers light machines are better utilized in fairer skin individuals because darker skin individuals may suffer mild epidermal burns. Lasers work according to three principles or modes of action: photothermal, photomechanical, and photochemical modes of action. In the case of laser hair reduction, these lasers work according to the photothermal mode of action. Photo means light, thermal heat. Laser is light. Light energy is converted to heat energy when it impacts the target, and the heat generated then damages the target. So this is photothermal damage leading to the destruction of the hair follicle. There is a very important theory in laser use in dermatology, and that is the theory of selective photothermolysis. The term photothermolysis comes from the Greek word photo meaning light, thermo meaning heat, lysis is damage or destruction. So this is using light to heat and destroy. The key word here is selective. Selective means that we can selectively destroy the target without causing much damage to surrounding tissue. And we can do this by matching the wavelength of the laser or light machine to the absorption spectrum of the target chromophore. A chromophore is a light-absorbing molecule. In the case of hair, it is melanin that we are trying to target. And in addition, we also try to match the pulse duration. The pulse duration is the time the laser is pulsed onto the target. And the pulse duration is adjusted so that it matches the thermal relaxation time to produce selective destruction of the hair follicle. Let's have a look at these. This is an illustration of the absorption spectrum of the three main chromophores. Remember, chromophores are light absorbing molecules in the skin. The three main chromophores are melanin, colored in black, oxyhemoglobin, which is found in blood, colored in red, and water, which is found in all living cells, is colored in blue. I would like you to draw your attention to the blue zone. You will see immediately that in the blue zone, the lasers there will be selectively absorbed by melanin, because melanin have a higher absorption spectrum in that range, higher than that of blood and that of water, which is present in all living cells. So using lasers in this wavelength, we can selectively damage melanin without causing much damage to the surrounding tissue. So this is the uniqueness of lasers that we can use to smart bomb the target, causing little collateral damage. In addition, we also match the pulse duration. As mentioned earlier, the pulse duration is the time the laser is on the target, and that is adjusted so that it is equal to or a little bit less than the thermal relaxation time of the target tissue. The TRT for short refers to the time that's required for the heated tissue to cool halfway towards its initial temperature. Now, if you look at the second paragraph, you can see that the TRT of the target is different. In the case of hair follicle that we're trying to target, in order to achieve permanent hair reduction, it is 100 milliseconds. In the case of tattooing, it is 10 nanoseconds. Just to put you in perspective, 100 milliseconds, a millisecond is a thousandth of a second. In the case of tattooing, 10 nanoseconds, a nanosecond is 1 billionth of a second. So the time is different and the pulse duration has to be adjusted accordingly. This is how laser hair reduction works. The target chromophore, the light absorbing molecule in hair, is melanin. Upon impact of the laser beam, the light energy from the laser beam is converted to heat energy, and the heat energy ablates or vaporizes the hair. However, destroying the hair shaft alone will not produce permanent hair reduction. To achieve permanent hair reduction, we must also impact the hair producing cells as well. This is an illustration of the anatomy of the hair follicle. You'll notice two areas that are colored green. Deep below is the dermal papillae. This is near the hair bulb, and that's where follicular stem cells reside. And further up, there's another area known as the bulge area, where follicular stem cells can be found. Follicular stem cells are the cells that will produce hair. So these cells have to be damaged in order to produce permanent hair reduction. Just to emphasize a little bit more, the lasers in the blue zone that you saw in the graph earlier, they are the ruby lasers, alexandrite laser, diode laser, and Nd:YAG laser. So these lasers can be used to achieve permanent hair reduction. Another consideration is the penetration of the laser. You will notice immediately that the hair bulb or the hair follicle is located deep in the skin. So the lasers that penetrate to that level will be effective, whereas those on the right will only remove part of the hair strand and have no effect on hair growth, hence no impact and no results in terms of permanent hair reduction. In addition to that, we need to be cognizant of the competing chromophores. Remember that melanin in hair is also the skin's pigment. So in darker skin tones, some of the pigment on the epidermis may be impacted by the laser beam as well. We have ways of overcoming and avoiding damage to the epidermal melanin by using cooling devices that I will talk about briefly later on. But it also depends on the skin type and the type of hair and so on in order to choose the best machine for the individual patient. Laser hair reduction is done in different ways, but they're more or less similar. Before the treatment, I usually get the patients to apply an anesthetic cream. This helps to reduce the pain, and most patients find the procedure painless. Without anesthetic, it can still be done, but there is a little bit of a slight pain involved. With most techniques, we would trim the hair down to about 1 to 2 millimeters above the skin. In the case of diode laser hair reduction, we would apply a cold ultrasonic gel on the treatment area. This helps the handpiece glide along smoothly. It also helps the laser beam penetrate to reach its targets in the skin. Then the patient is asked to wear some protective goggles, and then, as mentioned earlier, in most cases we apply a cooling tip to the skin, to the areas to be treated. The cooling tip is often made of sapphire. This keeps the epidermis cool, so when the laser beam is pulsed into the skin, it doesn't impact or damage the epidermal melanin. Instead, it penetrates through the skin and reaches its target in the hair follicle. Then laser energy or laser light is pulsed into the hair follicles as shown. And we mentioned about the pulse duration. So the duration of each pulse is just long enough to cause severe damage to the hair follicle and the bulge area where the follicular stem cells reside, as shown. As mentioned, we try to match the pulse duration to the thermal relaxation, which in the case of hair is about 100 milliseconds or less. Eventually, the damaged hair is shed. Some fibrosis occurs in the hair canal, and in that way, permanent reduction is achieved. Another very important consideration is the hair cycle. Hair grows in 3 stages. On the left of this picture, you can see the growth stage, also known as the anagen stage. Next to it, on the right, is the catagen stage, which is also known as the transitional stage. And further right, the telogen stage. The telogen stage is also known as the rest stage. And after the rest stage, the hair is shed. So the telogen stage is sometimes also called the shedding stage. Because hairs are growing in 3 cycles, and because lasers have the most impact on the anagen stage, you need at least 3 treatments. So the number of treatments required will depend on a few factors. One is the thickness of the hair. Thicker hair, darker hair, treatments better. The area being treated. Some hairs in certain areas respond better and they need more, or some will need less treatment. And a lot depends on the hair's growth cycle. Generally, I would tell patients they need a minimum of 4 to 8 treatments. As mentioned earlier, as a very bare minimum is 3 treatments, because hair grows in 3 stages. But because some of the hair follicles are only partially damaged, I generally tell patients they need at least 4, and in some cases as many as 8 treatments, and this will produce very satisfying results. So this is a 808 nanometer diode laser. It's one of the lasers that are used for laser hair reduction. There are many, and I hope basically this short presentation will give you an idea how laser hair reduction is carried out, and the science behind it, and the way we can achieve permanent hair reduction. I would like to invite you to visit us at www.kblimskinclinic.com, where you can find more information as well as videos. Thank you for watching, and I hope to see you again. Goodbye.